Greetings to everyone. Today, Group 2, me, Sima, Siti Nooralina, and Anis presenting on the prescribing exercise to healthy adult, our case study 2 for sports science subject. So the case study 1 presents Miss Chan, who is a 40 years old housewife, seeing us for contact dermatitis. But she enjoys past health and has got no significant risk factors for cardiovascular disease and is enrolled risk category for exercise participation. So upon further exploration, she is interested in embarking on more physical activity for better health. So the task is to design a comprehensive exercise prescription for Ms. Chan using the FIPT principle. So before jumping into the prescription for Ms. Chan, I will explain a little bit on what is FIPT principle itself. FIPT stands for frequency, intensity, time, and time. So it's a fundamental framework used to exercise, used in exercise prescription to design and customize effective workout regimens based on individuals' specific needs and fitness level. So we can modify these 4 types of criteria in the workout program we're gonna design, which includes the frequency where we have to modify how often in a week we are working out, and then intensity refers to how hard is the exercise is, as in like let's say if you're lifting a weight, how heavy is the weight. So it defines the intensity. Time is how long each section takes, as in like how long I'm lifting the weight for, like as if it's 20 minutes or 25 minutes, and also the breaks I take in between the sessions. Then lastly is the type, which is what type of activity am I going for? Aerobic, or is it intense weight? I mean, like is it a strength workout and all? So why FITT? What is its important? It allows customization, which we can customize according to the individual's characteristic, preference, and also goals. Then also progression. With FITT, we can have a gradual adjustment and progression of exercise parameters over time to promote continuous improvement in fitness level, which means we can track our progress using FITT principle also. There's also safety. As we are customizing the exercise program, we are looking into every criteria of the client to minimize the risk of injury according to their characteristic. And also it is efficient because it optimizes balance between workload and recovery, ensuring optimal use of time and effort. So what are the criteria that we have to look into when we are prescribing a FITT principle in the exercise program is the client's health status, which has an effect on the tolerance on and safety of the client. So things that are under health status are the current health condition. In our case, Miss Chan is healthy, and Miss Chan's medical history, they have a good past health, and also existing medical condition. In our case, the Miss Chan has contact dermatitis. The second thing is the fitness level. We have to assess the baseline fitness level of the client. So first is to look for cardiovascular endurance, and then muscular strength, flexibility, and body composition. In the case provided, only cardiovascular endurance were given, which is the client has no risk factors of cardiovascular disease. The other fitness levels should be taken before giving the prescription. Third is the goals. So the goal of the client in seeking for advice for exercise program is to improve their overall health, as we have seen in the case study. And then for the preference of the client is we have to look into their lifestyle factors on what are the diet they are following, and then their daily routine, so we can give the preferred and the time that fits for their schedule. So we have to see the time constraint to design exercise program also. So these are the overall criteria that we will look into and into giving the FIPT prescription for the client. Moving on, I will pass to Arina to present on the first two principles of our FIPT in the exercise program we are prescribing to the client. Thank you.
Okay, hello, I'm Arina. So I'm gonna explain about the frequency and intensity part. So based on the case study, Miss Chan is under the low risk category. So frequency is actually refers to how often Miss Chan should engage in exercise session per week. So for someone like Miss Chan who are under the low risk category, it was recommended for 3 to 5 days per week for the exercise session. So, however, since Miss Chan is just starting, aiming for 3 days per week might be more manageable initially, with the option to gradually increase as she become more accustomed to the routine. So next for the intensity, we have 3. levels: low, moderate, and hard. So intensity is actually refers to how the person should work during the exercise session. So based on the case study, Ms. Chan is under the low risk status. So I would like to say like low and moderate intensity are actually suitable for her. And on how should we monitor the intensity are by using the perceived exertion or heart rate. So perceived exertion is actually RPE scale, rate of perceived exertion. We have 1 to 10. So the first one is a very light activity, hardly any exertion, more than like sleeping, watching TV. The next one, light activity, 2 to 3 scale, feels like it can maintain for hours, easy to breathe and carry a conversation. So 4 to 6 scale, moderate activity, a person can we get like a breathing heavily, and they can hold a conversation but somewhat comfortable but becoming more challenging. For example, like the person are able to talk but not staying comfortable during the activity. So for the 7 to 8 RPE scale is a vigorous activity. It's a borderline uncomfortable, short of breath, and can speak a sentence. For 9 RPE scale is a very hard activity, very difficult to maintain the exercise intensity and barely breathe or speak any few words. And the last one, the maximum one, is a 10 scale. Max effort activity feels almost impossible to keep going, completely out of breath and unable to talk, and the person may not maintain for more than a very short time. So for the heart rate, how to monitor the intensity using the heart rate, as I shown in the slide, the heart rate zone chart, we have zone 1 to zone 5. You can see a very light, moderate, hard, maximum, by following the percentage of the functional capacity. So how to monitor the using the heart rate monitoring by they can use to measure the heart rate during the exercise. It can be done using various devices, including like the heart rate monitors, fitness trackers, smart watches. So the most common way to measure the heart rate is through the use of chest strap or optical sensor that is worn on the wrist. So this device may detect the electrical signals produced by the heart, which can be used to calculate the heart rate. So for most people, the most accurate sensor is a chest strap sensor, which placed right over the level of the heart. So once they have monitored the heart rate, we can see 40 to 50% is a very light, 50 to 60% is a light for zone 2, 60 to 75% moderate, 75 to 85% hard, and 85 and above 100% maximum. So let's go for the next slide. Is the example of exercise that Miss Chan can use to add in a exercise session. So first, for the brisk walk, this is a simple and accessible exercise that can be done almost anywhere. So Miss Chan may start with a comfortable pace and gradually increase her speed as she become more accustomed to walking. So next, for cycling, whether on stationary bike or outdoors, cycling provides a great cardiovascular workout, and it may adjust the resistance or terrain to tailor the intensity to the fitness level. So next, for swimming, it's actually a low impact exercise that gentle on the joints, but it provides a full body workout and can be a refreshing way to stay active. Next, dancing. Whether it's a dance class or just dancing around the house, it's actually a fun activity that can get the heart rate increased while also improving the coordination and flexibility. For Tai Chi and yoga, so these mind body exercise is actually offer a combination of gentle movements, deep breathing, and relaxation techniques, and it's actually great for improving the flexibility, balance, and reducing stress.
Hi, my name is Nur Anis Najwa binti Ramli, and I will explain for the next part, which is the time and also the duration. So basically, Ms. Chan can apply an initial sessions of 20 to 30 minutes exercise, which can help Ms. Chan to build her endurance gradually and also reduce the risk of injury, and it can allow her body to adapt to exercise and also easier for her to fit exercise into her daily routine, which can increase the likelihood of adherence. So next, how does these short sessions of exercise work? So first is gradual adaptation. So it can start with a shorter duration, which can allow Miss Chan body to adapt to the demands of exercise without becoming overwhelmed. Next is it can build consistency. So a shorter sessions of exercise are more manageable for Miss Chan to incorporate into her daily routine, which can increase the likelihood that she will stick with her exercise program over the long term. So the next is progressive overload. So progressing to a longer duration of exercise can challenge Miss Chan's fitness level and can encourage her for a further improvement. So next is the example for this type, which is time. So Miss Chan can begin with a 20-minute walk. For example, like um, just a short walk, which can manageable and provide a good starting point for her to increase her physical activity. So next is she can progress to 30 to 60 minutes exercise, which can increase the duration of her workouts to continue challenging herself and can maximize health benefits. And last one, she can progress to a 45 minutes, for example, aerobic class, which is a longer session that can allow her for a more comprehensive training and a greater calorie expenditure. So the next one is a type, which is a mode. So first type is aerobic exercise. For example, we have walking, cycling, and also swimming. So for walking, Miss Chan can start with a brisk walking sessions, which can increase speed or distance as her fitness improve. Then she could explore different walking routes or can join any, for example, like a walking group in her community. The second one is cycling, which Miss Chan can ride a bike, whether outside or on a stationary bike, which can provide an enjoyable way to improve her cardiovascular fitness. And for example, she can start with a short ride and can increase duration and intensity over time to time. And the next one is swimming, for example, swimming or water aerobics, which can gentle on the joints and can offer a full body workout. For example, Miss Chan can begin with a water walking or gentle swimming strokes, which can progress to a more vigorous activities as she become more confident. The next one is strength training. For example, we have body weight exercise, resistant bands, and also light weight. So for body weight exercise, the example is like squats, lunges, push-up, and planks, which can be performed at home, which require without any equipment. Next, Miss Chan can start with a few repetitions of each exercise and gradually will increase and she will become more stronger. The next one is resistant bands. So these portable and affordable tools can provide resistance for their muscle strengthening exercise. For example, Miss Chan can perform exercise like bicep curls, chest press, and leg lift using her resistant bands of varying resistance level. And the last one is lightweight, which Miss Chan can incorporate light dumbbells or kettlebells into her routine to add resistance. For example, she can start with a lighter weight and higher repetitions can help to build muscular endurance and also can boost her confidence. So how it works. So first is comprehensive fitness. So a variety of exercise done by Miss Chan can target different aspects of physical fitness. Second one is reduce boredom. So variety in exercise types can help Miss Chan to engage and motivate herself. Next, injury prevention. So incorporating different types of exercise can help to prevent overuse injuries by distribute the workload across a different muscle groups. And the last one is functional fitness, which is a strength training exercise can improve Miss Chan's ability to perform daily activities such as she can lifting groceries or climbing stairs. So that's all for my part.
Thank you, Alex. So to conclude our presentation, the overall FITT prescription for Miss Chan involves for the frequency it's to 3 to 5 days a week, and then the intensity is to low to moderate intensity, and the time is basically to start from 20 minutes and gradually increase the time as she adapts to it. And then the type of activity and exercise she can follow is aerobic and strength exercise. Other than also following this prescription, we should also have a follow-up on the FITT exercise program we are prescribing her, which is to review progress and assess her adherence to exercise prescription. The follow-up can be done 4 to 6 weeks, and all this list of tests can be done to track Miss Chan's physical fitness, which is heart rate, blood pressure, weight, body composition, and also the distance she's walking and all. So in short, FICT principle is a very beneficial principle that we can follow in our daily life. Not necessarily should has to be someone. It is beneficial to someone who is having some health condition where they can also keep themselves healthy and also follow their other medicine prescribed by their physicians. Well, with following this FICT principle, we can have a long-term benefit and also track our progress. That is all from us. Thank you.